Hello, wonderful students. This is the chapter on legal dimensions of nursing practice. For this chapter, you will want to make sure you have your textbook available to reference any tables and figures, as well as have enough space to take ample notes off of the PowerPoint presentation, as there is a lot of important information in here that you definitely need to know. Here are the learning objectives for this chapter. If you can speak to these and apply these to your nursing practice, then you have accomplished your learning for this chapter. This chapter is tested very heavily on your HESI Block 1 exam, your HESI Block 2 exam, for all of your exams in Block 1 for your classes as well as for your final. And you will most definitely see them on the NCLEX licensure exam once you've completed the nursing program. Therefore, please memorize and commit these things to memory into your permanent memory, okay? Don't simply memorize, commit it to your permanent memory. What I want you to know is that a good and prudent nurse, I want you to know that as a good and prudent nurse, you're going to do everything in your power to prevent you from becoming a litigant and a defendant in a lawsuit. And we hope that this never happens, that you never have to be deposed. But if you do, you will have the tools to get through the process as unscathed as possible through this process. Okay, let's first start out with some definitions and terms. This slide has on it the definition of law and some terms related to the law and lawsuits. Take a moment and read through these to become familiar with them. Remember, you are also responsible for all of the terms listed at the beginning of each chapter as well as reviewing the practice questions at the end of the chapters. I don't think I have said that yet, but you need to review the practice questions at the end of the chapters. It's a good practice on NCLEX questions, and you really need to be doing at least 20 NCLEX questions with the rationales daily. It's important to mention that as a good and prudent nurse, you're going to do everything in your power to prevent becoming a litigant and a defendant in a lawsuit. There are different types of law also. There's public law, is when the government is involved in making the law. Private law or civil law is when things like contracts are broken or ownership of property is disputed. And the practice of nursing, medicine, pharmacy, and dentistry fall under this. Criminal law is a type of public law where charges like murder, manslaughter, criminal negligence, theft, and illegal possession of drugs are brought against people. So, where do our laws come from? There are four sources of law at both the federal and state level. The federal and state constitutions provide guidelines for establishing laws. Statutory laws are enacted by the legislature. The Nurse Practice Act is an example of a statutory law, right? The Nurse State Practice Act is an example of statutory law, which of course will tell you as a nurse or a CNA or whatever the role is, what is within your scope, right? Well, we will discuss this more in detail in the upcoming week, right? Administrative laws enforced by executive officers who have the power to make rules and laws. Boards of nursing at the state level are an example of an administrative body enforcing this type of law, right? So they literally can take our license away, right, if we practice outside of scope. That's why it's really important that you know you're practicing within scope, because again, doctors and other medical people are going to ask you to do things that are outside of your scope because they're assuming that you know what's within your scope, right? When a decision is made in these cases, if it has not occurred before, then the decision will set a precedent for other similar decisions to be made in the future. So here you go. You got the litigation plaintiff and defendant, right? The State Nurse Practice Act defines what you can and cannot do as a nurse. These rules do vary state by every state, right? We've talked about this in depth. So again, if you move to another state, it is your responsibility to know what's within your scope of practice. Each nurse is expected to practice within their scope as identified from the Nurse Practice Act of that state. Nurses are also governed by standards that have been developed by the nursing profession itself. These standards are intended to help guide our profession and make it known what every professional nurse that we're duty bound in order to provide safe and effective nursing care to each and every one of our patients. Credentialing helps identify nurses who are professionally competent, right? So getting credentialized in a specialty is always in your best interest. So first is accreditation, right? So nursing education programs go through very rigorous evaluations so that they can be deemed a good program with acceptable standards, right? And you definitely want that to ensure that the companies offering education are up to that standard, right? There have been schools that have been shut down, right? When they go through their credentialing every 8 years and have their visit, and they're no longer providing, that exceptional educational opportunity, then they go on probation and eventually they'll shut them down. And we've seen schools around, even in our state, that's happened too. If you've ever known anyone who is going to nursing school at a program that is not accredited, you should advise them to look for one that is, because there are tons of schools that aren't accredited for that reason, right? Because it's easier if you're not accredited, you can run it however you like. But then again, it's not going to be quality. So again, if you have friends or family who are going to an unaccredited school of nursing, then they need to stop wasting their money and go to an accredited college. Next up is licensure, where a nurse takes an exam and is deemed minimally competent to practice in the profession of nursing. The third is certification, where you meet certain criteria and you are granted recognition in that area as an expert, right? And an example is I have my CNE, which stands for Certified Nurse Educator, right? And I had to have a minimal number of years of experience, take an exam by the National League of Nursing, pass with a certain level in order to be granted this certificate, right? It's not an easy certificate to get, by the way. Oftentimes these certificates expire too, as does our CNE. So you have to stay current in your field and you have to take the exams again and again, right? To stay competent in that field. And that's okay. It proves that you're an expert in your field. I've been an educator for decades, and you know, having the certification just cements the validity that I have the education, not only the master's degree, but also the individual educational piece of it, where you're competent to be able to provide that service, right, to the students. So clearly, it only makes sense that you would want to get that upper higher accreditation. It is not required, but it does lend more validity to your name, your job, your what you're providing, right? So always get certified in your area of specialty. It would be a recommendation I would say to you. Let's see here. And there's also talk about what is needed to be a nurse in a compact state. And I'm just going to briefly segue into that content. Okay. Compact states means that there is reciprocity between the different states that belong to the compact states law for nurses. So if I have my nursing license in Arizona and I want to go back to Texas and work there, there's a reciprocity phase. So I can literally, in the past, prior to going back to Hospice of the Valley, as a second employer, I used to travel during the summer as my second employer, right? So I'd go back to Texas and work there for a 13-week contract. And so that's how that reciprocity works, right? The only thing I literally had to do was show them that I had successfully completed a nursing program and that I was working in Arizona with the license already, right? And then obviously I had to meet whatever requirements that hospital deemed necessary, not the hospital, sorry, that Texas deemed necessary as for licensure in their state, right? Which wasn't anything. There wasn't anything in additional. So when you go there, it's like you have a temporary license, and you're practicing there under that, right? So now, if you are going to stay there longer than a 13 contract, then you would want to either establish residency there or get a license in that new state, right? Please remember that you don't get to keep practicing under your license from another state, like Arizona, for example, in Texas. If you're going to live there permanently, they will make it mandatory for you to get a Texas license, right? It's primarily for the money, right? For the fees. because now they're going to be regulating your license there, so they should get the fees. This is one thing people don't remember when it comes to compact state rules, right? So, I mean, it's just like when you move to another state, you have to get a driver's license in that state within a certain time frame. I think the driver's license is 10 days, right? That's true about your professional license. You're going to practice longer than a 13-week rotation, then you need to be licensed in that state. Now let's talk about the unfortunate other side of nursing that we do have to talk about here as well, right? And that is for things that can cause you to have disciplinary action taken against your license. And I will also include a link in here that you can review on your own from the National Councils of State Boards of Licensing. So please make sure that you are doing your best behavior at all times. I will tell you up front, 70% of the cases that go before the State Board of Nursing for disciplinary action involve substance use disorders, and that number has stayed steady for the last 40 years. The other 30% make up other various reasons for licenses, suspensions, or revocations, including fraud, deceptive practice, assault, battery, gross negligence, physical, mental, or emotional impairments. So it's imperative that you always stay up to date on your latest evidence-based practice and always follow the proper steps in caring for your patients and their families. So here are the steps of a license investigation. So if the state was going to investigate your license based on a complaint from a patient or a provider or an employer, you will get a notice of investigation in the mail. There will be a fair and impartial hearing where both sides will provide substantial evidence to be properly looked over and delved into thoroughly. You are open to early legal counseling, and I would highly recommend you get it. That you have character and expert witnesses. That's why a lawyer will help you get those, and that you are thoroughly prepared for all the proceedings, right? This slide defines a crime and the two levels of crime. So we have misdemeanor. It's a less serious crime, right? And then we have a felony, which is a more serious crime. Tort law deals with wrongdoing someone else without a contract involved, right? Maybe this includes intentional torts or unintentional torts, which are, intentional wrongdoings or unintentional wrongdoings. But know that we're going to cover tort law thoroughly later on. Actually, let me cover it now. An intentional tort is an action that is done intentionally to harm another person. It doesn't necessarily need to have a negative outcome, as you are still held accountable for the attempt to do harm. Okay, so let's review the most common ones in nursing. Assault is words threatening to cause harm and some type of action to back up that threat. So a lot of people think assault is the actual physical component of assault and battery, but assault is just the words that are threatening what you're going to do with the battery. The battery is the actual physical contact that is made, and it can be when we're dealing with patients, it can be when we physically are in contact with the patient and we're doing things to them that they don't consent to, right? Or is an unauthorized touching of another person, right? That would be battery, right? Could include, fights and stuff like that, but it definitely can also include a nurse who's providing care against the patient's will and they're of their right mind, right? We'll talk about it more in detail later. But to avoid any possible charges of battery, always explain to the patient what you're going to do prior to doing it, right? Like I talked about with the Foley earlier. You want to talk through the whole process to make sure that you're getting permission to do what you're about to do, right? You definitely do not want to get a charge of battery because you're violating them without their permission, right? Some invasive procedure. So assault and battery is the intent and follow through of a harmful act. Defamation of character involves making remarks that damage another person's reputation or character. The communication can be either written or oral, and it must be falsely made to another person, which causes shame or a negative impact on the person's reputation, and presented as a fact rather than an opinion, okay? Libel is the defamation of character in writing. So if you're libel, that defaming stuff is all in writing, right? Oftentimes, celebrities will sue gossip papers for libel, right? Slander is the defamation of character by spoken word. Now, the way I remember the difference between libel and slander is spoken. So they both start with an S, right? Libel is when you label people in a written form. So hopefully that helps. Or S is sloppy mouth, right? So speaking or sloppy mouth. Invasion of privacy occurs when you do not honor a person's wish to be left alone. Like seriously, that's an invasion of your privacy. This right includes the right to have private information protected, the right to not be falsely portrayed or misrepresented, and the right to be free from intrusion. There are specific laws surrounding privacy called the Health Insurance Portability and Accountability Act, or otherwise known as HIPAA. HIPAA is huge in the nursing field and medicine and all together, right? Example, this would be discussing a patient's information in public places like elevators and cafeterias. We will go into more detail again on this on the next slide. False imprisonment is when you restrain a patient without following proper medical and legal guidelines. Restraints can be physical or chemical in nature. So using a medication is also a form of restraint if it's intended to knock the patient out so that they don't get up and wander around, right? That's restraint. It's just a medication, right? So it's chemical in nature. Again, we will go over restraints further in the semester because you definitely need to know them very thoroughly. Fraud is falsely representing facts by words or actions. It is meant to be intentionally misleading. This includes falsifying documentation or concealing information that should have been shared. Unintentional torts occur when a reasonable and prudent person would not normally do this action or lack of action. And then negligence is an act of omission or commission. You most likely may picture a child or elder not taken well care of when you think of negligence, right? Malpractice is similar, but it applies to professionals because we have been given the knowledge and tools to act in a reasonable and prudent manner, right? And when we don't do that, that's malpractice, right? So usually malpractice suits occur when there is an injury or death of a patient. In a malpractice suit, in order to recover damages, the plaintiff must prove one of the following elements are present. This includes not following the duty of what the nurse was assigned, not providing care up to the professional standards, maybe the lack of care or the action of the nurse that caused the damage, and the plaintiff deserves an award for the resulting damage, right? Liability is the principle that you are responsible for your actions and or the lack of actions, and this principle should guide your behavior as a nurse. These individual are our standards of care. They include failure to assess, failure to diagnose, failure to plan, failure to implement, and failure to evaluate. In other words, failure to carry out the nursing process effectively. Assault means that you are threatening the person in some way that you are going to make bodily contact with them. So saying something like, I'm going to slap them upside the head, or I'm going to force you to get up out of the bed. I'm going to make you get up whether you want to or not, right? All of these things you cannot say to your patients. These are all real definitions of assault and the verbal threat to the patient, right? Battery, on the other hand, is when you actually go hands-on and you touch the person. So for example, a patient says, no, I don't want to get out of bed. And now you've put your hands on them and you're helping guide them out of bed. You can't do that, right? To make them get up in a chair. This is a case of battery. So you have to be very careful with your patient's interactions, really understand what's going on with your patient and ensure that you're treating them professionally, legally, and ethically, right? Next, we're going to look at defamation. This is when you're communicating with another person outside of the person that you have the issue with, right? So the way I remember these, slander and libel, right? Again, a great way to remember slander is, slander starts with S, it's a spoken word or it's sloppy. And libel is labeling people in writing, right? And defamatory labels are both L words, right? All right. If it's slander, it's spoken. So for example, if I don't like Nurse Susie Q, and I think Nurse Susie Q was awful, I'm going to go to my other friends and colleagues and say, oh, Susie Q, she's horrible. She's lazy. She doesn't know what she's doing. She's incompetent. That's slander because I've spoken negatively about another colleague. Um, you can also, you got to be careful when you're talking smack about anybody, right? You got to be really careful because that is definitely slander. The way I remember libel is that I write them down as labels, right? So libel is a label that I've written about the negative aspects about a person. So instead of speaking those things to my coworkers, I go home and on social media, I post that Susie Q is a horrible nurse. She is incompetent and lazy and she doesn't know what she's doing. And I put that out there on social media. And I've now broken the law in both cases and can be held accountable. So I want to tell you, be very, very careful starting in nursing school. What you say and do, right? Your reputation starts on day one, your admission into block one, or your admission into the CNA program. What I'm going to tell you is you think that the nursing field in Arizona is huge or the medical field is huge, but it is not. Somebody knows somebody who knows somebody, right? So you need to be very, very careful with anything and everything you put out there. And you need to think, can I really defend what I'm writing or saying in a court of law if I was called to do so? Okay. Because this is a profession and professional people don't tolerate for their reputation to be tarnished. So just be very, very careful. Because you will be held accountable. Whether you claim you didn't know or not, or whether you claim it was your opinion or not, it is irrelevant. If you negatively impact them, then you can be held accountable in a court of law and you could lose big time, right? Okay. Don't say or don't do it. Just don't do it. Okay. If you're having a really bad day or you're really mad at somebody, let's say, I don't know, a million examples, but you didn't do well on a test, just go de-stress before you say something that, could be harmful, right? And you just don't really want to put it out there. Plus, you really should strive not to say anything in a time of anger because people tend to say things they really don't believe in anger, right? And you need to practice being reserved and being able to control that from coming out, right? So just, if you need to create a document on your device, type everything you're feeling and then delete it, right? Whatever. Just whatever you got to do so that you don't make a bad decision in the heat of moment and say, write, or do anything that could potentially risk your license, right? Like, you could be in a world of trouble, hurt, right? So just be mindful of that and always be thinking about what it is that you're doing and realize that in the world of healthcare and nursing, it's a very small world again, right? It's amazing how you could say something about somebody over here and not realize that somebody over there knows that person and knows their true personality and knows you're just creating trouble and maybe you're saying things that are inappropriate, right? Not you, but people, right? In general. So you just got to be very, very careful. That's it. That's all I'm going to say about that. Another soapbox. I'm sorry, but you gotta raise yourself to higher standards. You got to rise above the drama, and you're working really hard to get this nursing license. So please don't ruin it by doing something impulsive. So as the RN, who will be delegating to all the different disciplines like your CNA, your LNA, your LPA, your RN, your PCT, etc., you will need to have a good knowledge base of what is within the scope of each of these roles. That's why you have to know what's within the scope of all of these roles. You're delegating to them, right? So you will need to show that you are delegating effectively. Next week, when we talk about leadership roles, we're going to drill down more with what all those different roles are for our various healthcare members on our healthcare team. Then we are also going to be aware of the standards in our facilities. That's usually within our policies and procedures, and you need to know what these policies and procedures say, right? Now, per our accredited bodies, policies and procedures do have to be updated and reviewed every 3 to 5 years. And then I always recommend that you get more involved with making sure that the latest evidence is being used in your nursing practice. Find out at your facility how you can be part of the policies and procedures teams that looks at things that happen in your area. That way you can be part of changing the policies and procedures, right? It's a great way to really follow through on ensuring that you and the team is utilizing the best practice and best evidence-based practice. Then there's also credentialing standards that we have to have from our accreditors. And with accreditation for our healthcare institution, that's crucially important because you need to be accredited and show that you're meeting certain set federal standards as well as state standards so that you can receive insurance reimbursement from both state and federal resources, right? Almost 90% of our funds that we earn come from Medicare and Medicaid. So we have to reach and maintain these credentialing statuses, or we literally will go broke, right? And I'll be out of a job. So again, we want to make sure that we're following through on the standards for credentialing and accrediting. This applies to nursing schools as well, right? We are accredited by the Arizona State Board of Nursing through the Accrediting Commission for Higher Education for Nurses through the government. So we're accredited by both state and federal. Okay, false imprisonment is going to be when I have put a patient in restraints without having a doctor's order first in the chart, or that I put a patient in restraints that wasn't appropriate. So maybe I got the order and all that, but guess what? It wasn't appropriate. And when the doctor came down within 24 hours, like they have to evaluate the patient, they figured out that you put a patient that wasn't appropriate in restraints. You now can have that false imprisonment charge brought against you, right? Or you put them in a room and close the door when there's no reason to truly isolate them. You got to be very careful with this, okay? Then I also have to worry about HIPAA and ensuring that I'm not invading the privacy information of my patients, and also be very careful with fraud. You have to be careful with this one because, again, it could be defaulting on student loans, but it also could be inappropriate billing services for a patient. It also could be misinterpreting yourself in such a way that could be construed as being problematic. The one thing I'm going to tell you right now, write this down in big bold letters everywhere. You are never, ever, ever to identify yourself as a nurse while working in those Caribbean scrubs as a student nurse. You are a student. And if you say you're a nurse, that is an act of fraud and could cause you not to be able to be licensed ever as a nurse in Arizona. So just be very, very careful to always represent the truth and nothing more or less. Case of malpractice is different from negligence. Malpractice, for malpractice, you have to prove all 4 elements listed in the table. You need to know these because people always say, what's the difference between negligence and malpractice? Well, I just told you negligence was unintentional. No harm came to the patients with malpractice. We have to show that there was an existence of a duty. We have to show that the duty was breached. And typically, this is an intentional breach of duty. That intentional breach of duty has to cause harm or injury to your patient in some way, shape, or form. And it can be psychological harm, right? Not just physical harm. It can be psychological harm. And that harm has to be such that I can assess a monetary value to it, right? Because either it was a delay in care, they had to stay longer in a facility, or additional follow-up care was required because of whatever it was that we did, right? So my example for this, I have a person who is very anxious on my nursing unit, and they're on the call, or they're on that call light constantly, right? Pressing it like every 10 minutes. So I get tired of answering that call light all the time, and I tell my nursing assistants and my colleagues, don't answer the light in call room 5. She's always on it, just ignore it. They've been on the call light every 15 minutes. They just need to wait. So everybody follows through with what I say. They leave the patient alone. No one answers the call light. When I finally get around to room 5, that person is now in severe emotional distress and saying, "Oh my God, I was so scared. I felt everybody left me out," and they're carrying on. And to the point, I have a mental health professional have to come down and have a consultation with this patient because they're so distraught from the whole trauma from the experience, right? So now I'm having to bring someone else into the picture. So that's another service that has to be provided to the patient, and who knows how long that's going to have to carry on, right? So there's a monetary value that can be added there that shows that due to the detriment, we had to provide additional services, right? So now I've just created a case of malpractice where my patient could win litigation against me 100% in court. That's not to say there's a difference in what the litigation outcomes will be with malpractice and negligence, right? I can still sue you for $1 million for either one, but you just have to be mindful that with malpractice, you have to prove that there was a duty of care that was intentionally not carried out because of the harm that came to the patient. So just make sure when you're documenting factual information of what's happening to that person, what was done about it, all kinds of information. For example, if that patient leaves your care to go to another unit, so at 8:55, the patient left nursing unit A to go to hemodialysis, you write that in your notes. That way we know that the person wasn't on your nursing unit. They were down in dialysis having their dialysis done. Then 12:35, the patient returned to the nursing unit. So that way, if something happened during that time when they were gone, at dialysis, you're excused from that because you documented showing that you were not the person currently taking care of that patient, right, when the incident happened. And again, I'm just going to say this, and I probably said it before, and I'm going to continue to say it. Please never write, "Continue to assess and monitor." Nurses really love to write, "Continue to monitor." This is the worst verbiage ever in the history of healthcare. What are you monitoring? You have to be specific. You have to say, "We'll continue to monitor exactly what you're going to monitor," right? I guarantee you're going to lose a court case if you say patient stable and will continue to monitor. You're going to lose. Because a good nurse knows you have to be specific in everything you chart, right? What are you monitoring? You're monitoring vital signs. Are you monitoring pain levels? Are you monitoring response to pain medication? Are you monitoring antiemetics? What exactly are you monitoring, right? And you're going to list all the things you're monitoring if you want to list them out, right? The more you're precise, the better. Are you monitoring response to education that you provided? Be specific. Same thing when you write monitor for signs and symptoms, for example, of serotonin toxicity. You need to write what those are. Do you know what they are? Right? So then you need to document what those symptoms are that you're monitoring for. So I would document something along the lines of monitoring for the following signs and symptoms of serotonin toxicity, nausea and or vomiting, and go on down the list and monitor, the neurological changes and all that things that go with serotonin syndrome, right? So tachycardia, shortness of breath, agitation, restlessness, abnormal eye movements, high blood pressure. What else is serotonin syndrome? Hallucinations. Oh my God, the body temperature goes up significantly. They lose loss of coordination, lots and lots and lots of things. So just basically the gist is be specific. This slide reveals all the possible reasons a malpractice suit could be filed against a nurse. Please pause this and take a moment to read through them. In malpractice, what usually occurs is on this slide, okay? If the parties cannot agree to a settlement, then it moves to an arbitration board where it is looked over again, and the board will act as a negotiating agent for the two sides of the parties. If this still does not work, then it will go to a court trial. Usually it can be settled though before going to court. Nurses may also be involved in legal cases as a defendant and also other roles. As a defendant, you will want to hire a competent attorney and work closely with them. As a defendant, you will want to hire a competent attorney again and work very closely with them. Remember, as a defendant, you do not want to discuss the case outside of your lawyer. Don't talk to your friends. Don't talk to your trusted coworkers, none of that, right? Never alter a medical record. Work with your attorney and be courteous and professional on the stand, right? You may be called as a fact witness in a case, given only firsthand knowledge of the situation you are asked to be a witness to. And lastly, you may be called to be an expert witness. So what I'm going to say to you is this: you're not going to remember your patient that you took care of today, tomorrow. I promise you, right? Because we care for so many patients. That's why documentation is critically important, and thorough documentation actually is critically important, right? Because you're not going to remember what you did for this patient that you're getting up on the stand to testify for. So that's why your documentation needs to be thorough enough so that you're able to feel confident in your answer, saying this is what my documentation says, so therefore this is what happened, right? And then we have expert witnesses. They usually have many years of experience and are considered leaders in their field. This slide reviews all the possible reasons a nurse may have their license suspended or revoked. Please pause, take a moment and review these. We're also going to cover these more detailed in lab. Going back to HIPAA for a moment, let's review the rights for a patient has regarding privacy and their healthcare information. This slide reviews those rights. Take a moment, pause, and read through these. Nurses' intimate knowledge of patients' health information puts us at risk for HIPAA violation, right? Because we're well aware intimately of everything they're going through. So you just got to respect that access to that information and not violate the HIPAA violation, their confidentiality. Fines for HIPAA violations are up to $250,000 per violation and up to 10 years in prison per violation. These rules govern even accidentally violating HIPAA, and we will go over these more in detail in lab as well. Here are some recommendations if you're a defendant, if you're a nurse defendant, right? Again, do not discuss the case with anybody other than your lawyer. Do not alter your medical records. You only want to discuss facts, not your opinions, but facts. Cooperate fully with your attorney. Be very courteous on the stand. I cannot stress to you enough how juries really hate obnoxious people. So please remember that. Be courteous to both sides, even when the prosecution's being a jerk to you. Do not volunteer any information. Only answer the yes or no. Be as succinct and short as possible. Dress like you're going to court, not a party, and think and collect thoughts before speaking. So take time, like when they ask you a question, don't jump on an answer, but actually formulate a good response in your head. Now that I have you on pins and needles thinking you are going to get sued somewhere down the line, I want to remind you that there are safeguards set to help you practice nursing without a large fear of being sued. Being competent, current, and knowledgeable about your practice will help safeguard you. This includes knowing what is in your state's Nurse State Practice Act, right? Following established policies and procedures, owning your own educational growth, owning your own emotional growth, you actually refusing assignments where you cannot perform safely. So if you haven't done something for a long time and you don't feel safe, you need to stand your ground and refuse the assignment until you've had time for your organization to get you some refresher on it, right? Keeping up with evidence-based practice is definitely a priority. Respecting your patient's rights and developing rapport and trust with your patients. Documenting accurately and timely, it's got to be timely, and working with management to develop any necessary policies or procedure changes to assist and guide, updating care at your agency. There are even processes for impaired nurses to get the help they need, as opposed to just being fired or having their license suspended. First, you must self-disclose that problem to the state and work with the State Board of Nursing to complete the addiction program prior to returning to active duty. If you are discovered taking controlled substances and you have not self-disclosed this, now we're talking controlled substances that you don't have a prescription for. So you're getting them from friends, buying them off the street, you're getting them from family members who happen to have them, whatever that looks like, right? Um, God forbid you're not stealing them from your patients, right? Diverting it. Uh, and you have not self-disclosed this problem and you're still working, this protection will not be offered to you. So basically, the protection comes to you is if you realize that you have a problem and you go to the state board before you're caught, then they'll work with you 100%, right? However, if you're caught, then you could lose your license. You could go on probation or lose your license. Really depends on the severity and what was exactly occurring, right? Addiction problems with nurses occurs more often than you think. Informed or voluntary consent is needed for admission, diagnostic, and treatment procedures, and any experimental treatments or procedures. So you must be of legal age and sound of mind to give consent, right? These are written and signed by the patient or their legal guardian representative. Informed consent respects the patient's autonomy to make decisions for themselves. If the patient does not speak English, they will need a translator. The procedure or treatment needs to be explained fully by the surgeon themselves, the person who is performing the treatment with the patient, not the nurse, right? So the person performing the treatment is going to go over all of the benefits as well as the risks, as well as alternatives to this procedure that the patient could potentially utilize instead of this procedure, right? So again, the surgeon's going to go through all of that with the informed consent. All the nurse has to do is watch the patient sign the consent. But again, only after that information has been given. And then the nurse just needs to make sure there's no additional questions. If a patient says during the informed consent signature, after the surgeon has explained all of those aspects, they say, well, what about blah, 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 then you want to call the surgeon back down because, again, it's not your responsibility to explain the procedure, all of the risks and benefits and rewards and other alternatives. That's the surgeon's responsibility. Can explain back to you, the nurse, in their own words about the treatment or procedure is a good way to assure the patient knows what they are signing, right? So doctors will do this many times, or surgeons, when they go into do informed consent, they'll have the patient express exactly what they're saying in layman's term, and then so they know they got it, right? Such a great tool that we use as nurses too in education, having our patients reteach us back that information, right? You know they got it then for sure. Okay, so now that at the point that they understand everything and all the alternatives and all that, right? Then you will witness as the nurse the signature. Right. Contracts are mainly used with nurses and their employers. I'm going to say make sure to fully read all contracts before signing, right? A lot of contracts with patients are really more implied than not written, right? So like some of the things, we have a mutual agreement that we'll both work toward finding the best resolution to your illness and all those things, right? Let's see. Collaborative bargaining is a legal process in which representatives of employees in organized groups negotiate items like wages or work conditions and things like that, right? Many nurses choose their state organizations over trade or union organizations, but in California, they have a new nurses union, and they were able to negotiate mandatory nurse-patient ratios. So that proves there's power in numbers. So I'm telling you, we need to get together, you guys. So you're the leaders in this field. You're going to be you're the future. So you really need to get out there and you need to start, you know, organizing and getting power in numbers so that our voices are heard, right? Patient education is part of our daily lives as a nurse. If you didn't think you would become a teacher when you became a nurse, well, guess what? You're wrong. We are there to help our patients manage their own care and they rely on us to provide them with the knowledge to do so, right? So it's our job to teach them how to take care of whatever it is, like the wound change or whatever, the dressing changes and stuff like that when they get home. Planning, executing, and documenting patient education are all important steps for nurses to perform. Get your patients involved in their care right away and be sure to document any refusal of teaching, right? Nurses are legally responsible for carrying out the order of the prescriber unless you may think that order will lead to harm or injury to your patient, right? And make sure you know who can legally write orders in your states. Know your agency's policies and procedures regarding those orders. Get all orders in writing and avoid verbal orders if possible. Now, can this always happen? Absolutely not. But if you do get a verbal order, you need to make sure, one, that you're repeating the verbal order completely back to the physician to ensure you heard it 100%. And not only that, but you also need to make sure the physician comes in and actually signs that order, or they don't necessarily need to come in. They can access it electronically, but it needs to be signed within 24 hours. And if not, you need to follow up and figure out, like, get them to sign it, right? So we do really try to eliminate telephone orders to true emergency situations, right? And then we're going to repeat the order back, document the order, date and time, the situation regarding needing the order, and if possible, have another nurse listen in and confirm the order. It is your duty to question any order that is not clear. Contrary to normal practice, it is our job as a nurse, okay? So you got to speak up. That's key. In documentation, we say, if you didn't document it, you didn't do it. And that is the honest to God truth. So the more thorough your documentation can be, the more reliant you will be on the fact that you can prove in a court of law that you provided exceptional care, right? And that's literally what you want to document, like if you're documenting if you were going into court tomorrow or in a week, right? And your documentation must contain only facts and be very precise and non-judgmental. And of course, in a timely manner. So all of these things take practice. We're going to be doing a lot of practice documentation, tons of it, to teach you these things. This should include even routine acts that you perform with the patient, okay? So even if it's a routine act, you want to document it, because if you didn't document it, it didn't happen. We'll go more into this with the do's and don'ts of documentation later on in this semester, okay? Large use of social media places nurses at risk for potential patient privacy and confidentiality violations. If you inadvertently violate the HIPAA Act, you may face disciplinary action by the Board of Nursing, including reprimand, sanctions, or even possible loss of your license. Also, you most likely will lose your job at work. As a nursing student, you will be dismissed from the nursing program. This is very serious. Large corporations like Banner of Dignity or Honor Health have full-time paid staff members that all they do is run through the social media of all of their staff members and notate misconduct. And also they go through students' accounts that have been assigned to their facility. There's full-time people who do this, you guys. So be very, very careful now that you're in nursing school to protect that potential license to be, okay? My suggestion to you is that you get off social media starting now and don't even risk putting anything out there that could come back and get you in trouble. Inadequate staffing on a unit can cause nurses to be stretched too far, compromising patient care and good patient outcomes. Mandating overtime or extra shifts or floating nurses from another unit down to another unfamiliar unit jeopardizes patient safety, and we see it happen all the time, right? I mean, what are you going to do when there's call-outs and stuff? You cannot use understaffing, though, as an excuse for poor patient care and poor patient outcomes, because I'm going to tell you right now, the State Board of Nursing is going to say, I don't care that you had staffing issues. You are a professional, and you have a license, and you have the right to say, this is not safe. I refuse to put my patient at risk, right? So you must be proactive, and you must work with management to solve the problems, these type of problems. I would start with maybe refusing an assignment you cannot handle and documenting each time that occurs, and make sure to get nursing management involved right away, right? Whistleblowing is oftentimes risky as some employers may take it out on the whistleblower themselves, right? They're retaliating. But there are laws to protect someone if they make a concern, to the public. Because it's a risk, and then they're retaliated against. There are laws against that. So try to work internally before going outside the agency. It's recommended when you are practicing a professional to purchase. It is recommended when practicing as an RN to purchase professional liability insurance. We hope your agency will back you in a lawsuit, but just in case they don't, you want to have your own insurance, right? Sometimes your employer will have limited coverage, or you're no longer working at that agency when the lawsuit is filed, right? So this really does help protect you. Personal liability insurance also covers you outside of your agency. I have always carried liability insurance when I was working in the hospital and as a home care nurse. Now, I don't carry it now because I work for hospice, and you see a lot less of that kind of stuff. So, but that's my decision. Some other nurses at hospice do carry liability insurance. It really is a personal choice, but you just need to be cognizant of it and really think about picking up some extra insurance. It's pretty cheap. It's not that expensive. A JAWS culture encourages open reporting of errors and near misses, right? So when we say JAWS culture, that means like if you make a mistake, you want people in medicine, nurses, CNAs, doctors, everybody, right, to own up to it immediately so that we can try to reverse it so that it doesn't kill our patient, right? That's what a JAWS culture is. We have that security knowing we can speak up to help our patients, right? A near miss is when something almost went wrong, but luckily it was caught before it happened. Risk management departments are there to investigate, analyze, and address risks at the agency. They look for the root of the problem, and usually it lies with systems or policies or procedures. It is very important to complete an occurrence report when an incident happens because these go to the risk management department for research to be done to figure out exactly where the breakdown happened, right? So it's critical. So to make those improvements and stop these incidents from occurring, we need this investigation to be done, right? So they look at safety, quality assurance programs, and stuff like that. You're also encouraged to report any near misses, as this is an indicator there's a problem in the system. For example, back in the day when I was a neuro ICU nurse, we used to store the liquid meds for all of our patients in one fridge, and they did not have their separate room compartment sections. It was just all in a fridge from Costco or wherever, right? And I almost made a med error going in, pulling out the med for one of my patients, right? Because the medication, and make a long story short, the medication's white, and I looked in the fridge, saw white med, pulled it out, right? Well, we do 3 different medication checks for a reason, to ensure we have the right medication, and we didn't pull the wrong medication out of the drawer, thank God, because on the 3rd check, I caught it. Well, I told them about this near miss that could have potentially killed my patient, right? And now the organization changed it, and all the organizations are like this now. They've all changed it now where with the refrigerated meds, they all have their own room number, right? So that's why you report near misses. So when you're looking at the reports, when you're filling out the detail reports, it literally looks things at like what exactly was happening, who was there, who was called, what was done, what was the situation, and so only factual items are recorded. The nurse who witnesses or discovers or performs the incident is the one who fills out the form. So I filled it out in my example, right? You can always ask your supervisor for assistance in filling out these forms if you're new to it, by the way. I had to the first time I filled it out. The next slide will go over all the needs to go in an incident report because you do need to know that. A sentinel event is an unexpected occurrence where there is a death or a serious physical injury to the patient. Okay, so that's called a sentinel event. These sentinel events need to be investigated immediately in response by the agency, right? These usually include unexpected deaths, maybe suicides. Oh my God, cutting off the wrong surgery site. Like we're supposed to do a left below the knee, but they did a right. That was an actual patient situation. That's why we start. The surgeons sign the area they're going to be operating on. All kinds of stuff, right? So an in-depth root analysis will be performed to try to get to the bottom of the problem and prevent it from reoccurring, right? Okay, then we have never events are extremely rare medical errors that should never occur to a patient. There's also a growing trend to not reimburse the agency for any treatment for the results of a never event, right? So for example, a patient should never get a bacterial infection from a Foley, from a sterile, aseptic insertion technique, right? So sterile technique. So it's a never event. So right. So this is something that the admitting nurse will go over with the patient upon admission so they know what to expect of the hospital and what the hospital expects of the patient. Again, we're going to go more of this in detail later on in this semester. Good Samaritan laws are designed to protect healthcare personnel when they are rendering first aid at an emergency situation, right? So the Good Sam law says this: if you're driving down the highway or down the street and you see somebody who's having a medical emergency, you have the right to either keep driving, you don't have to stop, you're not obligated, or you can stop and help. Now, if you choose to stop and help, you cannot abandon that patient, right? So if you stop to help, not a patient, but you can't abandon that person. Once you opt in to help them, you have to stay with them until somebody relieves you, usually 911 and the paramedics, right? But you can't leave them once you opt to do that. And the Good Samaritan law says that you won't be held accountable if what you're doing is in good intentions if you were to harm them accidentally, right? Okay, let's see. But they do expect if you do opt to stop you to help that person that you would use good judgment in rendering care. So you are going to be held accountable to the level of education that you have been given, right? In student liability, you are responsible for your wrongful acts, including any negligence that results in patient injury. So be very, very careful when working with patients, right? Our school insurance policy provides coverage for clinical nursing done for educational purposes. You need to be familiar with the facility's policies and procedures where you're going into to do your clinicals, right? And where you work, and you need to follow them. As a student, never perform a skill that you have not been taught, and always notify your nursing instructor or the patient's nurse if you feel a patient's status or condition is changing, like immediately, right? I had a student save a patient across the street at Banner Desert. We got assigned to one of the floors. They went out to meet their patient. When they walked in the room, the patient was in severe respiratory distress, and they counted the respirations at 38, right? Normal is what? Normal is 12 to 20. Let me think, 12 to 20, and they were at 38, right? So she came to me and she said, "Hey, can you come check this patient out? I think their respirations are at 38." And I was thinking initially, like, wow, that can't be right. Like, there would be a rapid response in the room dealing with that, right? But I'll be darned, she was right. And students catch stuff like that all the time, you guys. So if you know there's something, you think there's something, if you just think there's something wrong, get a second eyes on that patient, right? As soon as I walked in that room and saw that patient struggling, they were tripoding, man, they were doing all kinds of stuff. I hit that rapid response button in the room, and we had the team there, and they transferred that patient to a cardiac floor because it was actually the heart that was causing the respiratory distress. So good job for the students, right? All right. Remember, if you were not taught it, you don't do it. It's that simple, right? So NG tubes are not till block 3, right? So in block 2, when you go to the hospitals, you're going to have nurses say, "Hey, let's place an NG tube." Guess what? You weren't taught it. You can't do it, right? And almost always an instructor will want, in the clinical setting, will want to visualize you doing different tasks before you're actually able to do them with a nurse, right? And especially in block one, you need to have your instructor be there with you almost always, okay? Unless they give you permission. So always reach out to your instructor. All right. Anytime you have a question about doing a skill or an interaction with a patient, please call your clinical instructor first, just to be sure. You want to follow the rules, make good decisions, and you'll be fine. Negligence is when there's a duty of care that needs to be done for a patient that somebody else with the same amount of education would have done, with the same amount of background, the same amount of preparation would have done for that patient that you failed to do for that patient. With your cases of negligence, though, what typically happens in the real world is that something happened that was an error, and it was an innocent error. For example, I had a nurse who was busy caring for a patient who tanked and was having severe shortness of breath, respiratory rate of 28, and her post-op patient came back from surgery, and yes, the nurse, my friend, knew she had to have their vital signs assessed every 15 minutes times 4, every hour times 4, and so forth. Right? There's a specific post-op assessment schedule that the nurses on the floor have to do, and you're going to learn about that next block in block 2. Right? So you don't need to memorize that part now, but you do need to know that, even if you're busy with a severe shortness of breath patient and you don't get to do those 15-minute assessments and 30 minutes have gone by, it wasn't an act of intention, it was just an act of omission, but it did happen, right? And maybe no actual harm came to the person, but there still was negligence that happened due to the situation, okay? Another example may be that you get busy working with your patient and you say, oh, I'll be right back with, something, I'll be back with your pain meds in 10 minutes. And then you get caught up with another patient, something, big happens, right? And then 45 minutes later, you're like, oh crap, I totally forgot to get their pain meds. I was supposed to get that and take them right back there. And so now when you remember it, you go back and you apologize and you say, I'm so sorry I got sidetracked. I'm here for you now, and you're genuine with your apology, and maybe no harm came to the person, but still it is an act of negligence now. So just be aware of that, okay? Here are the elements of informed consent. Please pause the video and read through these. These are very straightforward. This also talks about the different types of risk management programs that different organizations might have. Just to peruse these, you don't need to memorize them. Information contained in an incident report, you definitely need to know this for your exam. So everything on the slide needs to go in an incident report. So please pause the video and take a moment to read through them. They're very straightforward. Okay, laws affecting nursing practice. So the Occupational Safety and Health Administration, or OSHA, has established protocols for healthcare workers who may be exposed to bloodborne pathogens. And so you're expected to follow the standard and isolation precautions that we are going to teach you in nursing school. You must be also aware of the safety precautions for electrical equipment, for radiation, other chemicals that you might be exposed to as a nurse, right? We're going to teach you that as well. And we're also going to teach you when you might be exposed to these in a clinical setting, right? If that even occurs, right? The National Practitioner Data Bank is an information clearinghouse where all practitioners are registered and tracked for professional compliance. Nurses have certain mandatory reporting obligations. This includes suspected child abuse, suspected elder abuse, if we suspect rape. If a patient has a communicable disease, we do have the authorization and the requirement to report those communicable diseases, like TB, right? TB could take out an entire population rather quickly. We have to report abuse, which could include physical. It also could include verbal abuse, sexual abuse, emotional abuse, neglect, abandonment, all of these, right? And failure to report them is an absolute crime. So we have to report the abuse. It's part of our obligations. And again, we're going to go into this more in depth a little later on in the semester. Narcotics, depressants, stimulants, and hallucinogens are all controlled substances. And there are laws that help regulate these and the distribution of these, right? And we are responsible to keep them secure and properly signed out when used. Title VII protects employees from discrimination based on race, religion, sex, or national origin. Sexual harassment includes any unwelcome advances, requests for sexual favors, other verbal or physical contact of sexual nature, right? So even a joke could be sexual harassment if it's offensive to anybody. You do not have to tolerate any type of discrimination or sexual harassment on the job, okay? Long-term care residents have the right to be free from physical or chemical restraints. Chemical restraints, again, is medications that we use to calm the patient down and keep them nice and relaxed in the chair and out, right? No. So if you're giving a medication to calm them down, that's one thing. But if you're getting them to knock them out so that they're physically not able to get out of the chair, that's just another form of restraint called a chemical restraint, right? Unless it is necessary for their safety. Now, there will be times, again, when we're able to get a physician's order first, and then we can put them in restraints if it's for their safety or if we need to, do medical treatments of some sort, right? There are many laws and rules regarding restraints. Again, we're going to go over them way more in detail in the semester because you do need to know them as a nurse. The American Disabilities Act, or ADA, covers any person who has a physical or mental impairment that limits their ability to perform activities. This also protects people with HIV and AIDS, people recovering from drug or alcohol addiction, and people who are regarded as disabled. Employers must make reasonable accommodations for people with disabilities. Sometimes nurses are asked to be a witness to someone signing their will. There are a few guidelines to follow prior to agreeing to do this. Make sure the signer is of sound mind, that they are acting voluntarily, that they have not been coerced in any way, and you both should sign in each other's presence. Make sure it is actually a will and not some other document, and make sure the benefactor does not sign the will. Legal issues surrounding death and dying will be discussed later on in the block when we cover loss, grief, and dying. Excuse me. OSHA legal regulations. So pause the video, read through these, very straightforward, common sense. I guess the only one I really want to talk about that may not be common sense is the safety data sheets. So every organization, every single organization, and whether it's Target store or whatever, right, including hospitals, we have to have safety data sheets that discusses every single chemical that we have in that building and how you can treat exposure to that chemical, like if you were to inhale it or get it in your eye and stuff like that. That's what the safety data sheets are for. And last slide. So this is mandatory reporting laws, right? So again, this talks about what has to be reported to, and it's pretty self-explanatory, so please pause the video and read through it. This concludes the chapter on legal dimensions of nursing. Make sure to review this as often as you need to truly understand it, okay? See you in class.